All right, it's Dr. Scot Gray back here again with you to go over something called a Merrick chart today. Now the Merrick chart we're going to look at here, I'll actually put one up on the video here. What we can see here is over here on this side we've got this snake looking thing here, that's the spine. Then over next to that we can see a list of numbers. This is the C1 through C7, those are going to be the cervical spinal nerves that come out of the spine. Down from that we see T1 through T12. And that's going to be the thoracic nerves that come out of the spine, and then L1 through L5, and those are the lumbar nerves that come out of the spine. And right next to that, you're going to see the areas and parts of the body that those nerves supply. So if you look at C1, it says blood supply to the head, pituitary gland, scalp, bones of the face, brain, inner and middle ear, sympathetic nervous system. So those are the areas of the body that that nerve supplies. And we talked about earlier that the spine and the brain controls every cell, tissue, organ, and function in the body through the nervous system. And here we can see a picture of how this all works. So if we go down a little bit further, if we look at T3, what we can see is that it supplies the lungs, bronchial tubes, pleura, chest, and breast. Down a little bit lower, we can go to the L5, supplies the lower leg, ankles, and feet. So those are the areas and parts of the body that those specific nerves go to. If we look at, next to that, we've got the possible symptoms that can be caused if that nerve is irritated, and so the area and part of that body that nerve goes to won't function properly, and we can get symptoms at C1 such as headaches, nervousness, insomnia, head colds, high blood pressure, migraine headaches, nervous breakdowns, amnesia, chronic tiredness, dizziness. So those are just some examples up at the first cervical vertebra. If there's problems there, I don't know if any of you have had some of those symptoms before, such as headaches, nervousness, high blood pressure, things such as those. If we go down to T3, some of the possible symptoms that T3 can cause are bronchitis, pleurisy, pneumonia, congestion, and influenza. So those are all things that if that T3 nerve is interfered with, that can come as a possible symptom from that. And down here at the bottom, we see at L5, poor circulation in the legs, swollen ankles, weak ankles and arches, cold feet, weakness in the legs, and leg cramps. So those are some of the things that you can experience if those nerves are affected at those areas of the body. And I'll go ahead and put a list of these up on the website so you can see those. Thank you very much.